Hi, everyone. Welcome back to the podcast. I welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know where the specialty of sports PT is getting stuck, you have to tune on to this episode. Before I go into the episode, what is new? What is better in life? If you can't see, those who are watching this podcast on my YouTube channel, I'm actually wearing a polo shirt. For some of you who have been around, know that I'm an anti-polo wearer. I'll get onto that on a different episode, but I have a disdain for wearing polos around. So both professionally and personally. So what is happening? My son Zach, who's a 6-year-old, we were disagreeing about something. I can't remember off the top of my head, but he shocked me. He said, "Hey, Dad, based on everything we're saying right now, are we arguing? Are we having a conversation, or are we disagreeing?" He blew me away. I was like, wow, he understood tone, he understood context. Man, he is surprising me every single day. And I appreciate that question coming from a 6-year-old. So Zach is doing awesome. Alex is absolutely crushing her gymnastics. And Jacob is currently in the um he is understanding. My son Jacob is 2 years old, and he's understanding his place in this world. He's the third child, and so he is always trying to defend himself. So at the moment he is we call them pow pows in this house, and so he likes to give his brother and sister pow pows when they're not being nice to him. So we're trying to not teach him violence, but he is finding his way into this world and trying to figure out where he plays a role. Other than that, life is great. I am training, and I have so many projects at the moment. I'm releasing a new course. I have one upcoming October. I've got my academy. I've got a couple people signed up to my self-study courses. Shout out to you guys. And I'm excited to just absolutely crush it this year and get a lot of sports PTs upgraded into positions and into the domains and education that they want. So I have a couple different projects. So it's absolutely nuts at the moment. All good things. But on to this podcast. So um, I think our profession, our specialty is getting stuck at the moment. And um, the reason why I'm talking about this is because I just had a presentation today, right? And that's why I'm wearing the polo. I had a presentation today, and it was to future law enforcement. So they were in academy. My job was to introduce injury prevention and what things lie ahead for several months in an academy. And after I gave the speech or the presentation, I had people ask me, and they said, "Hey, do you do cupping? Uh, yeah. Do you do scraping? Yeah. Do you do manipulations?" I was like, "Mobilization? Sure. Well, do you do taping? Do you do these things? Do you do whatever?" And all I can think in my head was, I see you're asking about professions, you're asking about disciplines. So, do you do massage? Do you do athletic training? Do you do chiropractic? Do you do physical therapy? Do you do these things? And all in my head I can say was, I see the consumer thinks that they are segmented. All of these services are segmented based on the profession. And I thought to myself, well, actually, a fantastic sports PT can do everything that you're talking about. So, why is the consumer asking if a sports PT can deliver on these specialty services that they perceive are different professions? And I was like, well, wait a minute. So, if the consumer is thinking this, we're not delivering the message or showing them. And our current specialty, our current um, APTA sports physical therapy specialty section, everything that we do is promoting sports PT, right? And we're trying to advocate for our profession. But at the consumer level, these people who are hearing the presentation, they don't get any of that. It doesn't trickle all the way down, right? So they don't know any better. It's not their fault. All they want to do is feel better. So I thought to myself, there is a brick wall that is very difficult for us as sports PTs to break through, both internally as a profession, and number two, most importantly, to the consumer. And this podcast is all about where we will get stuck as a specialty. And you, as a current or future sports PT, need to know this and how to combat that, how to not be dependent on other people or specialty practices doing it for you, and understand that what lies ahead is real. And you need to be able to maneuver around that in your respective community, in your respective role. So that way you're successful, and your success is not dependent on what other people decide or what other people do. That's what this podcast is about. So if you're looking for where it is as a sports PT you need to work on or improve, I'll tell you this: it's not inside more knee CEUs. It's not inside a back pain CEU. It's not even in a movement course CEU. This is beyond that. This is something that, are you spending the time that you need on the right things? And if not, what do you need to pay attention to that will limit your professional growth at the consumer level and within our profession? So let's talk about that. So a couple of the cadets asked, they said, hey, do you do these skills, right? And I said, yeah, we can definitely handle that. And they said, well, do you have a massage therapist on staff? Do you have an athletic trainer on staff? Do you have an acupuncturist on staff? Do you have a physical therapist on staff? Do you have a chiropractor on staff? My question is, I had to think, why do we have to have all the professions? But I don't understand why some of these people can't mix and mingle and do a little bit of everything. Because ultimately, you're not asking for the skill, you're asking for the effect. Let me say that again. You're not asking, do you do chiropractic? Do you do massage? Do you do cupping? Do you do scraping? Do you exercise? Do you do tape? You're not asking for that. You're asking for the effect. Do you produce the effect that will help me conquer the marathon or whatever it is? That's what the question is. But the consumer doesn't know how to ask that question. They're just like, hey, I've been taught that these are profession or skill-based things inside a profession. So I'm going to ask, do you have this type of person? Well, we have that we have that person inside our clinic who can provide that effect, but they might not have the label that you're looking for. But I don't think you're looking for the label. I think you're looking for the effect. Well, if that's the case, we can produce that. Then I thought, we can do that. But what is stopping other clinicians from being able to do that? So let's start from the top. Our profession, and even our specialty sections, they advocate that we want to be multidisciplinary providers, right? We want to be a sports PT who can manage acute care. We can manage strength and conditioning. We can manage rehab. We can manage return to sport. We can manage so many different elements within sports PT. I 100% agree with that. I think that's fantastic. That's what we're going to be doing as a profession. Here's the whole challenge with this thing, right? Let's say you don't do a residency or the SCS, right? Say you're curious about where the next, like, how do I advance within the sports section? What if you can't do maybe you have a family and it'd be a financial burden to move and relocate and do a residency? It's not for everybody. It's very difficult. And for some people, they choose not to for whatever reason. That's fantastic. You can still be a good sports clinician. So then, okay, well, what if I want to commit to the SCS? What do I do? How do I do that? And if you don't go those two traditional routes, most people say, well, I don't know how else you're going to become a sports PT. I think there's several ways around that. And all you have to do is look at what are the 8 or 9 domains that define a sports clinician, right? And I go over this in my Kickstarter self-study and my program, online mentorship program, that within these domains, all you need is exposure and you need clinical practice. I think you need some type of mentorship to get practice and get an opportunity to use these skill sets inside your clinical practice. So if you can tackle this, everything from acute injury management to taping to bracing to the roles of a physical therapist to strength and conditioning, injury prevention, wellness programs, all of these things, I think that you still need to be able to apply these skills. The challenge is our specialty practice saying, hey, we're sports clinicians. We can do all these things. But if you don't have those two qualifiers, a residency or an SCS, can you still be a sports PT? Absolutely. The consumer can care less about an SCS, OCS, whatever initials. They are looking for the effect. They are looking for the outcome or the result of what these initials are supposed to be able to help you produce. Now, our specialty practice is saying, yeah, we can do all those things. But here's the interesting part. Let's say you do take the SCS or you do residency and you now have these initials and you've worked really hard. Great. Now you work in a clinic that doesn't offer any of those services. They're a traditional ortho sport or ortho clinic where you don't get to use any of that. I don't know if that's beneficial to you then. The next question is, what if you're an SCS and you work in these type of facilities where you're able to use them? Great. I think it's fantastic. Now you have to be able to deliver on all of these services. What if you're a clinician who doesn't have an SCS or hasn't done a residency, but has exposure in strength and conditioning, in acute injury management? Maybe you shadowed, maybe you were an athletic trainer in undergrad, and you work in an ortho clinic that doesn't have any of these, any of the exposure. That doesn't help you anyways. Now, when you look at the profession and these disciplines, these specialty practices, we're saying we want you to do this. But once you complete an SCS, you no longer have the commitment to explore further the specialties or the 8 or 9 domains within sports clinical practice. So even if you had your SCS and somebody said, hey, could you help me out with strength conditioning? There's a lot of you out there who would be like, oh, I don't know about that. I kind of know a little bit, but not much. I still know I only do 2 to 3 sets of 10 to 15 reps, 2 to 3 times a day. And you don't like to harm people or apply load. And so you're concerned. So you're really not a strength conditioning specialist, even if you have your SCS and you don't practice it. So what if you have your SCS and CSCS and you still don't know strength and conditioning? Those initials don't do much for you. So our profession advocates that we can do all these things, but the challenge becomes we don't require, we don't provide specialty CEU courses so that people become proficient in each one of those 8 or 9 domains, or they can explore that. Because once you take that test, you no longer have any requirement outside 10 years of recertification. But leading up or between that time point, there's not a time that you're actively working on strength and conditioning. You're not actively working on these things. And the consumer just wants the effect. So that at the specialty level, at the professional level, they say we can do these things, but they don't force you or require you to do them. So we say, oh, we're good sports clinicians. However, there's nothing to push you in that direction to continue that. And at the consumer level, when this cadet in the academy asked me, do you do scraping and cupping? I was like, I mean, that's pretty basic. Yeah, absolutely. It's not their fault. They don't know any better. What I realized is they think that physical therapy is a compartmentalized profession where you just do exercise, you just do a little manual therapy, or you just go in and do exercises and you go in only when you have surgery, those type of things. And I realized that what they're looking for is not a physical therapist, athletic trainer, chiropractor, massage therapist. They're looking for a healthcare provider who can kind of do it all. And in my head, I'm like, oh, you're looking for a sports physical therapist. That was my reaction. But in their head, they don't know any better. They were asking for different skills to be provided by different providers because that's what the norm is. My question to you and everything about our profession is, why can't you as a sports physical therapist provide all of that inside one session? Do you feel confident enough to provide manual therapy, um, exercises, scraping, cupping, taping, mobilizations, manipulations, uh, and design a rehab program and design a strength and conditioning program all in one session? Can you do that? And if you cringe at that thought, great. Now you know where your limitations are. If you say, well, I have a little bit of skill in strength and conditioning, I have a little bit of skill on athletic training, I have a little skill in acute injury management, a little skill in taping, great. That's the whole job. And so when you compartmentalized physical therapy into exercise and post-surgical rehab, that's what the consumer thinks. And what I'm telling you and what I'm going to create is a an academy, a network of people who want to not be limited by what the profession advocates but doesn't provide in support, but also is not a 2 to 3 sets of 10 to 15 repetitions with the CSCS and an SCS, but doesn't know how to apply it and can't do anything for the consumer. The goal here is to be able to provide a well-rounded approach, meaning including all forms of rehab and pain relief. You are musculoskeletal experts, not just uh, manipulation people or tapers or massagers or rehabbers or therapeutic exercise experts. Sure, that might be the traditional, like polo wearing, khaki wearing, inside a clinic type of a clinician. But what you're really looking for, what you strive to, is how do I provide all forms of services to help somebody across a timeline or their lifespan where I know as a 15-year-old, they're going to potentially have growing pains. How can you help them with getting back to high school football, high school soccer? Because you love that, right? You can totally do that. What about when they have an acute ankle sprain? Can you do it day one of the ankle sprain? Can they come into your clinic and act like an urgent care? Can you support that? If you're like, oh, or you think you're confident, and in reality, you'll flare them up by doing traditional 6 to 8 weeks type of a PT versus the acute injury management, which is very, very particular and very specific to how you manage somebody within a short period of time. What if they're an ACL now 6 to 8 months out when they're 19 and then you return to sport? Can you take them from month 6 all the way to month 12 with a specific strength and conditioning program? Can you get them to return to sport with full agility, linear, lateral, multi-directional progressions based on progressive overload? Can you take them from pain relief to injury prevention to strength conditioning to return to sport? Can you do the full gamut? And when they're 24, 25, and they have aches and pains because they're now professional and you can manage their low back pain and get them back to CrossFit or whatever it is, or their job as a law enforcement agency, can you do that? And now that they're 30 or 40 years old, can you help with pre-postpartum care? Can you manage other situations, not beyond just a knee ACL or back pain? Can you help somebody throughout a lifespan? And now that they're 50 and 60, can you work on strength and conditioning to increase bone density and not be pain relief experts? Can you be musculoskeletal experts that can handle anything that comes at them from any form of healthcare, whether that's acute injury management, taping, bracing, you name it, post-rehab, post-operative care, acute injury, acute ankle sprain, MCL sprain, to post-operative return to sport, getting back to activities, to barbell mechanics, to strength and condition? Can you manage the gamut? And if you can't, you're just a physical therapist. And you might say, well, that's what I was trained to do. Yes, but if you want to be a sports physical therapist, to be able to manage anything that comes at you, you really want to be a healthcare provider, meaning you can talk about nutrition, you can talk about strength and conditioning, you could talk about recovery. You don't have to just talk about post-operative care. Can you manage all of that confidently? Doesn't mean you have to be an expert, but if somebody says, hey, what do you think about this diet? The reason why they had knee pain is because they had improper recovery. They didn't know how to enter a marathon training program. So your job is not to fix their knee. How about you work on the program design and the progressions? Maybe they didn't go incrementally. They just went too fast, too hard, too soon. And if you pay attention to the knee, you have this super narrow lens. Where's the root of the problem? They weren't sleeping properly. They weren't eating properly. They weren't staying hydrated. And they went all out too fast, too soon with too much volume, too much intensity. And they happen to develop knee pain. So if you fix the knee pain, all the major reasons why they develop pain, you're not attacking. Why? Because you were a physical therapist with narrow lenses. The goal here is to expand that and say, what else am I missing? Do I need to take a CEU course in nutrition? Do I need to take a CEU course in some form of sports recovery? Do I need to take a CEU course in strength and conditioning? Yes, you do. And that's what I'm saying. Our profession, our specialty practices are saying, yes, we are for this. We definitely need that all our clinicians can be able to manage all these things. Yeah, it's not a requirement. There's no CEUs that are even offered that specialize in this for physical therapists. So our profession is saying, yeah, we're all out, almighty sports PTs. But when you look at it, nothing is offered to support that mission besides an SCS. And even after an SCS, between that and recertification, there's a big gap. So don't depend on the profession for creating these things. Don't think that they are here to do it for you. It is your job, but it comes from your drive. Do you really want to be different? Do you want to provide a spectrum of healthcare? In my head, that's where sports PT is going. We're not just rehab specialists or musculoskeletal experts. We're healthcare providers that can take and just have a human that we can literally from 15 or I don't know, 9 years old to 99 years old. Can you manage musculoskeletal health? Can you manage their nutrition, their overall approach to exercise and fitness? Can you program for them? Can you help them understand what bone density is and take them through a spectrum and not be concerned, well, do you have pain? I don't want to push it too hard. Guess what? They're going to push on their own. So either you follow and support them along their journey, or you see them incrementally only when they have pain. You're only going to see them when they're in the hole, when they have pain, and you're only bringing them up to baseline. If you want to be a clinician who's baseline and above, meaning if you only get people to a certain form of health only because that's what insurance says, or that's what we're taught and trained, we only get them to baseline, and now they're out of pain, we do this one thing that is very horrible for us, and we discharge them. Now we're assuming that they know what to do. They don't know what to do. That's why they're coming here. And you as a healthcare provider needs to understand that you're not just here for pain. You're not just here to help them get out of pain. You're here to get them out of pain and beyond. How do you get them back to going to F45 or Orange Theory or Jiu-Jitsu? You know that they don't have the skills or knowledge to be able to do that successfully on their own. Your job is to support them through that. Now, if you just get them out of pain and throw them back in, guess what? It's only a matter of time before they come back. Why? Because that's what got them there. They didn't know how to recover. They didn't know anything behind the scenes. And so I think there's a lot of logistical challenges to this, but I think you having an understanding what the limitations are and solving this on your own is a very critical piece. Create your own path. What is it within sports PT that you want to accomplish? I bet you it's not just postoperative care, because that's already offered and you've already taken those courses, or you already thought about taking those courses. Now, it's not about taping, because that's just a piece of it. And some of you don't think that modalities are going to be critical, but in acute injury management, it is. Have you taken that course? Have you taken the strength conditioning? Have you taken courses that will help people across the lifespan, or only to get them out of pain back to baseline? Now, if you ask, well, what's wrong with just doing back to baseline type of PT? Nothing wrong. But that's what your professional growth be limited to. Those are the people that you're going to be seeing forever. Those are the athletes you're going to be seeing. So if you want to work pro sports, you want to work elite level sports, you better know how to manage them across a lifespan. You better learn integumentary and derm. Derm is a big issue when you work with high profile individuals who are constantly sweating, in contact with others, work with jiu-jitsu, you work with pro athletes or wrestlers. You better know your dermatology. You have to. If you work high-end, high trauma sports, I used to work BMX. You better believe triaging and your CPR and everything beyond that, and spine boarding. It's just what you want to make of it. Now, if you want to be in a clinic, that's totally fine too. But if you want to have an opportunity to work in all domains within sports physical therapy or sports health, you need to understand that if you continue to take CEUs that are just the knee, just the back, that's the outcome that you're going to get. Those are the people you will forever work with. If that's for you, good for you. But if you're trying to be different and a true sports physical therapist in line with what our profession, our specialty practice says, they say they want this, but nothing is offered to deliver on that besides the one test. And even then, there's a gap on recertification. But it's not up to them to test you to keep you on track. It's your job. So what type of people do you want to work with is the question. I'll tell you what, I like working with people who are active, fit, or want to be active and fit. And those people are motivated. And if you work in a clinic right now, or you're on your rotations and you say like, gosh, the people I see, they don't seem like they want to get better. They don't want to do these things. Well, that's because you're not pushing them. Why? Because your lens is on their knee and their back. How about you push them to look outside of that? What is it that their fitness needs? They need to move more, test them, push them, join a gym, do more, do a half marathon, do a 5K, push them, create the program for them, create the wellness program for them, get them to a point where they understand. And if you rely on our profession or specialty practice to tell the public of what we do, I'll tell you what, the one thing that we don't do is we don't improve the way people move. That's not what we do. It's one element of what we do. Movement is a big domain. I was trained by Shirley Sarman, a movement pioneer in our profession. Movement is a piece of the puzzle. And especially when you work professional sports and high trauma, when they're on a spine board, you're not improving their movement. When they come out and they have a concussion and you get them back to sport, movement's important, but progression is even more important in that phase. When you're working with an acute ankle sprain, movement's important too. But if modalities, bracing, taping, progressions, week by week progressions, and return to sport timelines are more important than movement. Now, when people are 6 weeks in chronic pain or whatever it is, movement is very critical. So movement is a domain within orthopedic and sports PT. But if you don't understand acute injury management, you don't understand on the field training, you don't understand strength conditioning and off season. And when somebody's in off season and no longer has pain, movement is very critical, but load and intensity is just as critical. So if you don't understand that and you apply the movement to everything, that's where the public gets confused. And that's why they say, oh, you're a physical therapist. Do you happen to know a good massage therapist or an athletic trainer or chiropractor, whatever it is? Oh, I see. You think I only do this skill. As a profession, I'm a physical therapist. That's what I do. However, as a healthcare provider, I can help you with all of these elements. And that is where our PT profession, our sports PT specialty is getting stuck because we say we want it, but we can't deliver on it. So there's a huge gap in the consumer. They hear, oh, sports PTs, great. The problem is when they come in to see you, you stay within your domain. Musculoskeletal, hold on. I can't talk about nutrition. I can't do that. No. I don't do taping and injury management. I don't do strength and conditioning. I only do exercise. Well, then that's your fault. That's where you are going to go. And if you're working around peers who only do this practice, guess what? You're not getting any better. You're going to be stuck inside this. The only way that you improve as a physical therapist, you go outside, you gain a network of people who think like this, who want to be better, who are actively doing it, not just people who are saying they're doing it. And I tell you what, if you're stuck inside CEU courses that are region-based and pain-based, that's where your specialty is. But if you're on looking at increasing performance, getting more athletes on your schedule, being able to create more and more programs, getting acute or direct access people into your schedule, that is a domain you want to work in. So if you're not taking courses or not working on that, guess what? They don't just magically appear. They don't magically appear. Strength and conditioning, patients and clients and athletes, they don't just randomly appear. They're not educated by some random commercial. It's by you showing them. But how do you show them? You actually take the courses or you increase your knowledge and implement. So if you're saying, hey, I can build a program for you, that doesn't work. You have to show them. And so our profession is saying here that, yes, we're going to go ahead and advocate for being a multidisciplinary healthcare provider. but no sports clinical specialist or anybody outside of that is taking additional courses to actually reinforce that and to actually prove to the public that we can do these things. So if you want to be a skill-based, profession-based physical therapist, then that's your choice. But if you want to be a healthcare provider who can manage anything that comes at them with a lot of caveats, safely, responsibly, and within your professional domain, that's a whole different spectrum. And that's the reason why I've I love healthcare. I love being a physical therapist, but I love being a healthcare provider who can provide more. My first exposure to that was professional sports. They asked, "Hey, do you do these things?" I absolutely, I just delivered on that. And they never knew what my profession was. They didn't say you're a physical therapist, massage therapist, or athletic trainer. They just knew you're a provider who can provide an effect. That's it. And I want to share this with the rest of the planet, sports PTs just like you, because it is powerful, the effects that you can do and what people say and what that can do for our reputation as a profession is massive. But it comes from the ground level and actually showing the public that you can do something different, not at the top. So where are we getting stuck? We say we want more, but we can't deliver on it, and we're not reinforcing that with continued education. So that's the whole reason why I built my Chris Garcia Academy and the Sports PT Academy and everything in between. It's literally my passion. I hope this fires you up wherever you're doing, you're driving or you're in the gym. Yeah, it's everything I stand for and everything I believe in. And I think this is the next step for us as a profession. And this is where I'm going to contribute my energy and my effort to changing this planet and offering a different track for physical therapists who are passionate about this. So if that's for you, you got to come to one of my courses, join my academy, do something, get yourself out of the rut, get yourself out of the same monotonous blah 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 CEU, this mobilization, grade 1, grade 2, here's the new exercise with the fancy twisty thing, whatever. It keeps you in the same mindset. So your energy, wherever your attention goes, your energy flows. So if you're still in those courses, that's where your attention energy is going to go. How about you bring your attention somewhere else? Your energy goes that way. You actually work on developing instead of just whatever's on Instagram, YouTube, or whatever it is that you're following. So if you're interested in that, if that's for you, go and join my Sports PT Academy. This is where I meet monthly with sports PTs all over the world, whatever it is that you need. Number two, just come into my management of the barbell athlete. If you're a fitness or healthcare professional with your sports PT, it's get you outside of just traditional PT. What is it that you can be offering? How do you work with personal trainers? How do you work with people in your community? How do you work as a healthcare provider to provide more as a multidisciplinary provider of effects, not just skills? So there you have it. If you're interested in any of those, go to my website, drchrisgarcia.com. Nonetheless, I just want you guys to think differently, and I hope this kind of stimulated that. So I'm excited to see you at the Management of the Barbell Athlete course, my academy. If not, I will catch you guys on the next episode. I hope you guys are doing well and absolutely crushing it. Get outside your comfort zone and understand that we are more than just sports physical therapists. Understand that. All right. I'll see you guys on the next episode. Take care.